Good afternoon, everyone. This is Siddharth Tambar. Welcome to our webinar this afternoon. Topic of today's webinar, physician-assisted weight loss program with semaglutide, a peptide approach. I have a little bit to present, but please enter your questions and I will try to answer them as we go along or at the end. Okay, so today we are talking about addressing obesity for better health. So, I mean, everyone knows this, right? But obesity, the scope of the problem, global health concern with profound impacts on really all of our health feeling, our health, whether it's cardiovascular, metabolic, immunologic, overall well-being, joint health for sure. Hundreds of millions of people this affects around the world. In the US, as of 2020, about 42% of adults were considered obese and about 9% of children and adolescents. So what we're talking about today is peptide treatment, in particular semaglutide, to address obesity and its associated health effects. So the health effects of obesity are very wide. You know, what I see every day is obviously the effects on the musculoskeletal system, whether it's knees, hips, ankles, lower back pains. Certainly cardiovascular consequences in terms of high blood pressure, heart disease, metabolic effects in terms of diabetes, immunologic implications, whether that is increased risk of infections or worsening autoimmune conditions. Definitely, you see that in psoriasis and psoriatic arthritis, higher rates of various cancers as well as sleep apnea, which then in turn has cardiovascular issues. So we really need better solutions for weight loss because obesity poses significant risks to long-term health, and we need better options to mitigate all these kind of health issues. There are limitations to our traditional methods. Diet and exercise is the cornerstone for weight loss and management of this, but it's really not adequate for many people. And that's in large part because conventional weight loss strategies, you get really kind of a yo-yo effect going up and down. And what we've come to realize over time is that weight loss and obesity, you know, it is to maintain this long term, you have to think about not only biologic factors, but you also have to think about psychological and environmental factors as well. And the latter two drive a lot of this and make this such a hard thing to really treat. So our physician-assisted weight loss program really is meant to address all of these kind of challenges. Our goals of treatment are not only weight loss, right, but they're also to improve body composition, whether that is reducing fat, but also improving muscle mass. Visceral fat is so key when it comes to cardiovascular risk. If we can improve weight and metabolic health, we can improve glucose regulation, cardiovascular risk factors, exercise capacity, which is so huge from a musculoskeletal standpoint, improving eating habits, improving immune and gut health, and improving sleep and stress management as well. So, you know, there are really three ways that diet can help with weight loss. Kind of three general ways, right? Number one is eat less than you're exerting. So if your intake is less than your output, you'll get weight loss. And that's how most weight loss programs work, which is eat less, try to do some exercise. Number two is eat less of specific foods, right? So, but the question is really which foods? There's so many different types of diets out there, and there are believers in all of them, and there are failures with all of them. Vegans go no animal products. People who are carnivore go only animal products. Keto is high protein, no carbs. And so it's just all over the map. There's some general good concepts with each one of these, but it's very hit or miss in terms of which one works for which person. Not to mention, you may be getting weight loss, but are you possibly causing other potential metabolic issues that may be hurtful for you for cardiovascular health long term? There's even the Mediterranean diet, which is very much a middle of the road process, where it tends to be a little bit more doable for people long term, and seems to be one that can help as well. And then, of course, there's eating only during specific periods of time. That's intermittent fasting. The classic intermittent fasting is 16-8, where you're eating for 8 hours, let's say from 10 a.m. till 6 p.m., and you're not eating the rest of the time. Tends to be a very, it tends to be a diet that can be done by most people because you're sleeping for about half of those hours. And so you're really not fasting for that long. And when it comes to managing blood glucose and cholesterol, that tends to be actually a very good option. A recent study was mentioned at the American Heart Association, however, that intermittent fasting may increase the rates of heart disease. And the jury on that is still out because there's a lot of potential issues with that study. But to me, the main takeaway is that while there's different ways to help on the dietary end, it's not that only one works. You really need to be sort of utilizing at least two, if not all three of these, meaning you should be eating less than you're exerting. You should be selecting out certain foods. And it probably is good if you're not eating all hours of the day. Like if you can reduce your amount of eating at nighttime, that's probably better for you long term. So there's aspects to all of these dietary strategies that are helpful. But I think picking only one is hard. And in terms of really being effective long term. And there's probably benefit to combining all three. And there are ways that semaglutide can actually help with that. So peptides, that's what we're talking about. These are, peptides are naturally occurring molecules or proteins that act as signaling molecules in the body. So what does that mean? It means that you have proteins in your body that tell your cells what to do. All right. So the one that's really the biggest one right now that people are talking about is GLP-1 or glucagon-like peptide 1. It's a naturally occurring gut hormone that regulates appetite, insulin secretion, and energy metabolism. So the studies for GLP-1 have been going on since, I think, even before the year 2000. But in the last few years has just taken off because of medications like Ozempic and Wegovy. There's now tirzepatide. So there's a number of different meds that are out there now that work with GLP-1, mimicking GLP-1. And it's because GLP-1 has a very key role in glucose homeostasis and insulin secretion. It helps to regulate your glucose level. And because of that, it's now approved for diabetes. And it also is a very key in our metabolic health. So much so that it's now also approved for weight loss. So semaglutide is a potential game changer in weight loss. And that's because it mimics GLP-1. And it has been shown to, in multiple studies, to have a very significant effect in promoting weight loss and improving metabolic health. So again, how does it work? Improves your glucose homeostasis, more glucose uptake into the muscles, less in the bloodstream. It reduces your large intestine motility. That means that it slows down the processing of food through your gut, and it reduces appetite, meaning it reduces the chemicals that are associated with hunger, and it increases the chemicals that are associated with satiety. And it also makes you more satisfied with the food that you've eaten. So the mechanism of action is really that it sort of helps to control appetite and weight through the brain-gut axis by slowing stomach emptying, by reducing hunger sensations, by helping you feel fuller sooner, and by reducing food cravings and food preferences. That last one is interesting because semaglutide has also been shown to help out with other types of cravings, whether that is when it comes to smoking and other kind of conditions where the brain plays such an important part in the habit as well. So what's interesting about that is, when you think about those three different ways that diet can improve your metabolic health and weight loss, semaglutide helps with all of those, in the sense that it'll help you eat less, it'll help you restrict the time that you're eating, and if there's certain types of foods that you need to avoid, it'll help with that as well. And I think the benefit of, to me, the lesson from that recent intermittent fasting study is that don't depend on just one strategy or one tactic. You need to hit all three of those. And I think semaglutide helps with that. So semaglutide is approved. It has 2 FDA-approved indications. It's approved for type 2 diabetes. It's also approved for chronic weight management in adults. And that includes for folks who have a BMI that's greater than 30, or interestingly, people who have a BMI greater than 27, and also have one other weight-related potential comorbid condition. That's a lot of different things, whether that's high blood pressure, diabetes, cholesterol, osteoarthritis, which, realistically is so much of our population over the age of 50, fatty liver, pre-diabetes, which is more and more people in our society, heartburn, PCOS, hypogonadism, and asthma. So other potential future preventative indications, which is kind of interesting, is can we help to prevent cardiovascular disease? And there's some data out there that's saying that semaglutide is very helpful for that. Can we help to prevent pre-diabetes in folks who are prone to that? So imagine if you are a woman who had gestational diabetes during pregnancy, where your blood sugar was running a little bit high. Well, that's an indication that you're at higher risk for diabetes later on as well. So there's some evidence that it may also help with neurodegenerative diseases, anti-aging, and definitely metabolic syndrome. Metabolic syndrome really means that your body is no longer metabolizing or functioning properly. And so now you're at higher rates for high blood pressure, diabetes, high cholesterol, fatty liver, even autoimmune issues. So it is sort of a common pathway that connects to a lot of things. So how do we actually use semaglutide? Essentially, it's a weekly treatment. You're injecting yourself once per week. The key is you have to start on a low dose and you escalate monthly. And the reason why you start on a low dose is you need to make sure your body is tolerating it. And essentially, we monitor you every month, make sure that weight is appropriate, that you're kind of slowly, progressively losing weight. Appetite is under control, and observing for any side effects. What typically happens is that first month, you may have some mild weight loss because you're on a very low dose. Your appetite is starting to come down. Toward the end of that first month, you may notice that that's sort of increasing again, at which point we then increase the dose. And you do that for a few months to get to a stable, higher dosage. And then something that I would definitely recommend is at baseline, check your metabolic health labs, and that includes some of your vitamin levels, and then checking that every 6 months to make sure that if there's a change in your dietary pattern, that it's still being done in a safe and appropriate way. So really, our goal is sustainable weight loss. It's sustainable weight loss. So, the results from clinical trials are exciting. And multiple studies have shown that that semaglutide can lead to substantial and sustained weight loss with treatment. So there are studies that are now going out to 2+ years, and what you find is that the average weight loss is about 15 to 20%. And again, wide range in that. There's some people who lose a lot more than that, but 15 to 20%. And that as long as you're taking treatment, that results are maintained long-term. And when you think about it, obesity, metabolic health, that these are chronic conditions. This is not the goal is not, hey, can we improve things short-term? It's how do we keep it going long-term? And what's nice is that with semaglutide, there's some good evidence that using this long-term is safe and effective. And of course, if you combine this with good nutrition and regular exercise, that's how you maximize results and stay healthy long-term. What's interesting about that last part is we all know that. It's hard to sometimes do that. And when you think about it, I think it's been said that to maintain or to learn a new habit or to break an old habit, you sort of need to do it for at least 90 days. You need to have that ability to do that. And that's very hard sometimes when it comes to either nutrition or a regular exercise routine. What's interesting about semaglutide is that at least on the nutrition end, it helps with that. It helps to maintain good nutritional habits because it takes away those kind of craving sensations. And if you're trying to get a long-term benefit, you need to make those kind of healthy changes long-term. In terms of safety profile, yeah, I mean, semaglutide has been shown to have a very favorable safety profile in sort of 2+ years of studies and in post-marketing studies as well. So post-marketing studies means that after medication has been approved, the FDA is still kind of following up to make sure that there aren't any sort of unexpected side effects. The most common side effects are mild GI issues such as nausea and constipation. That the reason why you start on a low dose is that you could figure out at a low dose whether or not you're going to get that or not. So it's not uncommon when you first start this that there's a little bit of GI kind of effects, not too bad. And that over time, your body gets used to it. And then each incremental kind of increase, your body kind of gets used to that next higher dosage. Keys to optimizing treatment, long-term, again, to get the best results, it's combining semaglutide with exercise and nutrition, right? And in terms of nutrition, it's eating nutrient-dense food, avoid overeating. From an exercise standpoint, it's doing both cardiovascular exercise to help improve weight loss and improve metabolic health. And when it comes to cardiovascular, it's sort of doing zone 2 cardio, which generally means that you're doing a level of effort where it's enough to get your heart rate up, but you can still talk relatively comfortably. And then the other key part of this is definitely doing strength training, meaning you want to prevent muscle loss. And I'll talk about that in a moment as well. But when you lose weight, you lose both fat and potentially muscle as well. And so if you want to improve body composition, maintain muscle strength, and not lose muscle, you really want to make sure that you're doing some form of strength training as well, from a maintaining muscle mass, but also if you can maintain muscle mass, that actually helps you maintain and regulate your blood sugar and your weight better as well. So lots of frequently asked questions. And again, if you have questions, please shoot them into chat or Q&A. But here's some of the most frequently asked questions that I hear from patients. Number one is, how long before I see weight loss after you start treatment? And for most patients, they will note weight loss in the first month, like some early weight loss. And if you have more weight to lose, you'll kind of notice more weight loss right up front. But what we tell people is the first kind of initial phase is really over the first 3 months. And so after the first month, you'll probably notice a slight bit of weight loss. But our goal there is really to make sure that it's suppressing appetite and you're tolerating the medication. And with each successive kind of increase, you should be noticing progressive more weight loss. So we start on a low dose and escalate as tolerated, but you should be noticing an improvement even in weight loss at that first month. So how much weight can I expect to lose? When you look at the studies, on average, it's about 15 to 20%. Again, we see people who do better than that as well. And but that's an average, right? And so we should be able to do better than that. How long do you need to continue treatment? Again, we recommend that initial phase do for 3 to 6 months. And the reason why is we want to make sure it's working. We want to make sure it's a right fit for you, that you're tolerating it, all that. Studies show that semaglutide is, however, most effective for chronic weight loss management. And what that means is that this is a chronic condition, and taking this longer term is what gives better results longer term. As people are on this longer term, when you're kind of reaching your goal in terms of weight, then you can actually lower your dosing. And what that means is you can actually lower either the amount that you're taking per injection, or you can lower the frequency that you're taking treatment as well. Yeah, actually, it's a good question that kind of got put in the chat. What if appetite isn't the issue? Does the drug help with metabolism? It does. So if you see, the reason why this is approved for diabetes is because it helps to shift your blood sugar from the bloodstream into the muscles faster, right? And so for diabetics, it helps with metabolic health in that way. And so it does help with metabolism and your metabolic health for sure. So the other frequently asked question is, do I need to eat healthy and exercise when using this medication? Absolutely, right? Like I think what we realize when it comes to metabolic health and weight loss is that you need to take a complete body approach to this, right? And semaglutide is great in the sense that it works on your metabolism and metabolic health, and it also helps your kind of appetite and satiety, but you have to tie in everything else. And so again, eating right from a nutritional standpoint is helpful, not just from a weight loss standpoint, but to make sure you're eating healthy as you're losing weight. And the exercise component is key, just to make sure you're not only improving your cardiovascular health, but also maintaining your muscle mass and not losing that or improving your body composition. And then, of course, semaglutide can help you establish better eating habits that benefit you long term. I think that's actually an exciting part of this. That I think a lot of dietary programs fail in the sense that trying to get people to moderate is hard. In some weird way, some of the more extreme diets, whether it's full-on vegan or carnivore, or even keto, I think that appeals to some people. Some people they can make changes when it's more extreme. It's sometimes harder for them to make changes when it's more moderate. And maintaining changes long term can be hard as well. And I think semaglutide helps with that. So can semaglutide make your muscles and bones weaker? So, weight loss results in fat and muscle loss. And again, focus on improving body composition. So that means resistance exercises, and it means optimizing your nutrition to maintain your muscle health and bone health. Whether that is making sure you're taking the right vitamins, vitamin D, B12, multivitamin, or doing the right exercises. It's just doing all the correct other things to make sure that you're protecting your health as much as possible long term. Yeah, great question. You hear about all the health risks using semaglutide. Again, like low risk, it's still a medication, right? It's still a peptide treatment. The interesting thing about peptide treatments, and this is not just with semaglutide, but I think for those of you that utilize peptides in your health otherwise, you kind of realize that it's sort of utilizing something that your body already has. And it's not giving you, let's say, a molecule or a tablet, right, that is completely foreign to your body. It's very much trying to take advantage of what your body's already utilizing. And so semaglutide does the same thing. I think most of the side effects that you hear with semaglutide are mainly GI. There's some other contraindications. So for example, if you have a history of thyroid cancer, right, there's a theoretical risk that's been shown in animals that you need to be careful about using semaglutide in those kind of people. If you already have diabetes and you're on medication, right, you have to be very careful in terms of watching your blood sugar. Like that needs to be managed properly. Outside of that, there are not a lot of like really common or published side effects of this medication. However, as with any kind of treatment or intervention, there's always, if you give treatment to enough people, there'll be an occasional person that has either a side effect or a coincidental problem at the same time. So another kind of FAQ, if I stop treatment, will I regain the weight? So a study came out recently, showed that if you stop semaglutide, and for some reason in this study, they also had people stop any nutritional or exercise changes that they were doing. They didn't guide them. Regaining 2/3 of the weight loss is possible. So really the key is, if you stop treatment, make sure you're maintaining good nutrition, exercise habits, right? Like if you kind of revert back to what caused the problems to begin with, you're going to have some slide back. Should you use semaglutide long term? Again, the data shows it is low risk long term. That's what the safety data shows. And yes, I would say encourage that because you can help maintain weight loss and metabolic health long term as well. Again, keep in mind that maintenance dosing could probably be a lower dosage or lower frequency. And so you're probably not requiring as much once you've kind of gotten to your goal level. And then how does semaglutide compare to other weight loss meds, right? So right now, you've probably heard a lot of other kind of newer weight loss meds, right? Those are the GLP-1 agonists, right? They're all in the same category. They're just sort of different versions of the same meds. And they're all very similar in terms of weight loss as well as safety. If you look at semaglutide compared to some of the older generation of meds, a lot of the older generation meds kind of worked by stimulating your metabolism, and they had other potential side effects, including cardiovascular issues. And the newer generation of meds that work on GLP-1 don't have those kind of side effects. And in fact, they're starting to show that they actually help to reduce the risk of heart disease as well, if you're at risk for that. And so the reason why I think these meds are really just kind of skyrocketing in terms of popularity right now is because they're safer than what's been out there before. and they actually seem to work better in terms of weight loss as well. Okay, good question. So yeah, I mean, so someone asking, will it help manage your diabetes and weight loss? Do you still take your diabetes meds? Okay, so number one, again, semaglutide is approved for diabetes, right? Like it's approved for diabetes and it's also approved for weight loss. So it's approved for two separate things, and it can help if you have diabetes as well. What I recommend, frankly, is that if you're seeing an endocrinologist and you're taking diabetes medications and they put you on semaglutide, like obviously let them manage that, right? Like if they're managing both your weight loss and your diabetes. And professionally, I will defer to my endocrinology colleagues. If they've got you on other medications for diabetes, I'll let them manage a semaglutide as well. Because I think they do need to then adjust your other diabetes medications. Whether you're able to fully get off your diabetes medications or not, it's kind of a separate story. Diabetes, whether it's type 1 or type 2, I mean, like it's more complicated. There's more to it than there's more to it than just one pathway that's causing it. And certainly if you're insulin dependent, where your body is no longer producing enough insulin, then you probably need to be on a combination treatment. Okay, good. So how are we doing this at Chicago Arthritis, right? So like we have a physician-assisted weight loss program where we're really trying to offer a personalized approach to weight loss management utilizing the efficacy of semaglutide. So obviously, definitely a thorough evaluation, making sure that you're an appropriate candidate in terms of history, what are your weight loss goals, is it reasonable, and any other underlying conditions, make sure that there isn't really trying to limit the risk and kind of maximize the benefit here by making sure you're the right candidate for this. We do this as thoroughly as we do everything else in the office, meaning with protocols, whether that is amongst the providers, me and the physician assistant or nursing, making sure that we're doing things by the book and doing it correctly, whether that is following your labs every 6 months, whether that is checking in on a regular basis, doing this properly, and continuously monitoring and adjusting dosing and treatment as required. That's kind of a big deal. Like you would think that would be a standardized thing, but it's surprisingly not. I see kind of two things that I've seen. Number one, I've seen folks who are on semaglutide, and for some reason, they've had a little bit of weight loss. I saw this today in a patient, but for some reason, her physician had not increased the dosage beyond that first, like that escalation. The initial dosing for semaglutide is very low, and the max dosing is literally 10 times higher. And so there is like a lot of gradation to that. And so saw this patient where like she had literally stalled in terms of her weight loss because they just hadn't increased her dosing. So that was kind of strange. And then on the other hand, I've seen other places where they just automatically keep on increasing the dosage. And that's not right either. Like not everyone needs to have their dosage increased every single month because they may be appropriately progressing. And so, and the other part of that is from a safety standpoint, you don't want to lose weight too fast. You want to lose it in a measured way. And that's not only from like a metabolic safety standpoint, that's even from like a aesthetic standpoint, that if you lose weight too fast, your skin is not adjusting to that appropriately. And you may then need to actually end up seeing plastic surgery to kind of then deal with like some of the skin issues that happen if you lose weight too fast. And so there is like a correct way to do these kind of things. And it has to be based on how you're responding. It shouldn't just be a one size fits all thing. And it should be appropriately adjusting so that it keeps up with your needs as well. So you're not just stagnating. And then again, I think checking your labs every 6 months to make sure that it's being safely done is appropriate. Okay, somebody else asking, the person is very overweight, has blood pressure and diabetes. Is this a medication okay for them? I mean, this is probably a treatment that is made for them, right? Certainly from a diabetes standpoint. Again, I think if you have your primary doctor or endocrinologist managing your diabetes, talk to them about using semaglutide as well to help with the weight loss. I think that certainly should be considered. Good question about, does insurance cover this? So this is a tricky thing, right? So this medication is approved by the FDA. Insurance is covering it for diabetes. They're really not covering it for weight loss. And so if you try to get this out of pocket for strictly weight loss, if you're buying this from a pharmaceutical company directly or from the pharmacy directly where they're selling you the brand name, the cost will be anywhere from $1,200 to $1,500 per month, which is a lot. And so essentially what we've done is we've been able to team up with an FDA-regulated compounding pharmacy that's able to get us semaglutide. We're able to dispense this at a significantly lower cost. And so our program essentially costs $450 per month. It includes medical monitoring, the medication, and the supplies as well, so that it is fairly straightforward and simple. And that'll take into account even when you're on a higher dosage of the medication, and it'll get you through this in a safe and appropriate way. Some good questions. Other questions for me. To see if you're a candidate for treatment, you can go to the website, and there's a link there, or you can just go to the general website. There's a QR code there as well that takes you to the same link as well, if that's easier to click on. Good. Other questions from you guys? Okay, great. Well, thank you everyone for your time. If you have any other questions for us, you can always reach us through the website. If you need to schedule an appointment for evaluation, in the chat, you'll see 3 different ways to do that. You can call us, you can email us, or you can actually schedule directly into our clinic as well. There's a link for that as well. And, I think semaglutide it's changing not only weight loss management, it's changing how we kind of approach metabolic health as well. The exciting thing from my standpoint professionally is that this is potentially a treatment that helps our patients with their weight loss needs, but helps them with their joint pain kind of issues as well, and especially lower back and lower extremity pains. And for our autoimmune patients who are at higher rates, are higher risk for cardiovascular disease long-term as well, it's such a great adjunct to help with that as well. Because until now, while we've had treatments that help with the inflammation part, we haven't really had treatments that do a great job of protecting our patients from the long-term metabolic health issues that they have, cardiovascular issues. And it's exciting to have those kind of tools and treatments now as well. Wonderful. If any other questions, please contact us at any time. And until we connect again, I hope everyone stays safe and be well. Have a good day. Bye-bye.